Good afternoon, folks. Al Mattingly, Davis County Judge Executive, coming to you this week with our COVID update. I'm going to give you a little update on the county, but I want to get right into our guest, my friend, good friend, Secretary Jim Gray, who that name may be familiar because he used to be mayor of Lexington, and Mark Carter and Jim, I forget what Mark did, but I know he's very important. And I think we've got Elena Smith on here. At least I see a picture. She may be in the back. And is Chuck Wolf with you guys also?
It looks like he is. Yes.
Okay. So
Yeah,
Chuck Wolf, all
joined.
these folks are from the state, and we're going to do a couple things after I give my update. The very first thing, Mr. Secretary, I'm calling you that because I want to talk a little bit about the Transportation Cabinet and a very exciting testimony that you did this morning regarding something that should be of vital interest to everyone in our Commonwealth. So, folks, to get started, Davis County has come a long way in the last 2 or 3 weeks. We're still in red, but we actually got down to about 26 cases per 100,000. One more case, you can help me get that one more case, we'll go into the orange. In Western Kentucky, we make up about a third of the counties, and all but 3 of those counties, 3 of 40 counties, are in the orange or yellow now. And that's tremendous considering where we were 6 to 8 weeks ago. And we're going to get there. It's just, sometimes things go up, things go down. That's why we look at things based over a time period, over a 7-day average. If we looked at it day to day, we'd get those very, very highs and very, very lows, and we wouldn't know what to think. Today in Davis County, we reported 43 new COVID cases. That's a little higher than the ones that we have been reporting, but still so much better than 100 cases a day. Unfortunately, we had 1 death in Davis County, and that brings our total deaths in Davis County to 151 people. That's 151 people who won't be here for Easter. They won't be here for the 4th of July. They won't be here for Christmas. And their families will not be able to give them a hug. I went to a funeral home of a very good friend, very dear friend, Monday. And his wife had passed away. Now, she didn't pass away from COVID, but still yet, they miss her tremendously. And everybody knows what it feels to lose someone. We have a total of 9,409 cases, positive cases reported in Davis County. 8,289 have recovered. You take the recovered cases and the deaths out, that leaves us with 979 active cases. Now, that excites me because as little as 3 weeks ago, we were reporting almost 2,000 active cases. And remember what I told you, Clay Horton, our health department director, said we probably have 3 to 4 times that many active cases out in the community. So that's an indicator of how many cases are out there, but it's also an indicator of how many folks might need the use of hospital or ICU. Right now, our current hospitalization is 10 people, and that's wonderful. That's down from a high of 31 or 32 about 3 months ago. There again is another predictor of the number of folks who may have some serious consequences, including dying. The last thing I want to talk about is a person asked before we came on the air, is there a way to report on the number of doses of vaccine that have been parceled out? And the secretary will get into this, but this morning the governor talked about the 5 different programs that we have going on in the Commonwealth. So that's 5 different programs getting vaccines and trying to push them out into the arms of our Kentuckians. And it's really hard to get that information together. But I can tell you in Davis County, according to the health department, we have seen 28,000 folks receive their first and or second vaccination. So that's not 28,000 individuals. It could be 14,000 who've got both shots. I doubt it. But somewhere around a quarter of Davis County's population has been vaccinated. And that's tremendous when it comes to producing herd immunity in the community, and it's tremendous when it comes to reducing the number of folks that have the vaccine or have the virus and can pass it on. And one of the greatest things is, I know we're wrapping up our nursing home vaccinations, our assisted living vaccinations. And Jim, I looked this morning, 90% of the deaths, 92% of the deaths in the Commonwealth are in those folks who are 60 years old or older. If we can vaccinate 1A, 1B, and 1C, think about it, we can reduce the death rate by 92%. I mean, that's huge. So that's a report on Davis County. We're doing good. I need your help. Biggest thing you can do right here, wear your mask, avoid large crowds, social distance, and do the thing that your mama and your grandmama told you to do from the time you were old enough to remember. Wash your hands, sanitize your hands. I always wear my mask, and I told the secretary and Mark that I did that just to emphasize how important it is for you folks to do that. So I want to get right into it, Jim. And the first thing I'm going to talk about quickly is, first of all, I want to say thank you. I don't know how many of you know how helpful the secretary has been to Davis County, but if you remember that little bitty bridge that's out on Highway 81 that it seems it keeps jumping in front of trucks and being damaged, Jim was very instrumental in us getting that bridge repaired and getting it repaired on time so that our farmers, our ag community, would have that bridge available when they were trying to take their crops to market. And also when the school, what little bit of school we had, when school started back, buses didn't have to take huge detours. He also greatly helped us on the regional Real ID Center. I don't know if you remember, but originally Davis County wasn't going to have one here. We were going to have to drive to Madisonville. And Jim will tell you that quite often I'll chew on people, and I don't care where they are or who they are. And working with him and Representative Miles and other folks in the transportation cabinet, we now have a Real ID system at the Davis County Operations Center out on Highway 81. And that Real ID is open to anyone that wants to come and get a Real ID. A couple of things before I turn it over to you. You notice once I get the floor, I keep it. I just want to take the opportunity to say thank you to all the state employees, particularly those here in District 2, and to Denitra Henderson, our District 2 engineer. They did a yeoman's job along with all the county employees in preparing our roads during the last, I said 2, somebody from your office said 3 recent storms. And we were fortunate we missed the majority of that first storm that came through. But whatever, it's a long time. We just had a training session for our road department guys, and I went out there and thanked them all individually and personally, because nobody that hasn't worked in that kind of job, you don't know what it is, what the long hours are, and how tired you get. So, Mr. Secretary, today you did something that I have done in the past, that a lot of people have done in the past, and you appeared before the General Assembly, before committee, and you talked about a bill that Representative Santoral dropped yesterday regarding gasoline tax, regarding how do we move forward over the next few years with repairs to our roads and building new roads and all that infrastructure that's so sorely needed in the Commonwealth. Talk to us about it. Talk to us about how important that is.
Well, Judge, first let me say I appreciate your invitation to be with you all today. And I appreciate your giving a shout out to Denitra Henderson, our Chief District Engineer. She is really extraordinary. She's one of 12, and they are all extraordinary around the whole state. But I appreciate you giving a shout out to our frontline transportation employees, the Department of Highways employees that were out the last couple of weeks. They're still cleaning up, of course, but they were on the front line. And I routinely say that we stand on their shoulders. We stand on their shoulders, and you said it so well, and I appreciate that. And you know, Judge, you know this very well. I refer to, for that, those of your audience, I refer to you as the dean of the judges in the whole state. And when
I think
was mayor,
he's called me, that's a good way or a nice way of saying I'm old.
No, I know better. Listen, when I was mayor, I would go to you and lean on you for wisdom and advice, and I always appreciated it. And I want to make sure that I say that. But today, yes, I did appear before the Senate Transportation Committee, Senator Jimmy Higdon's committee, and among other things, I talked about the challenges that we've got. And one of the major challenges, of course, and I would argue the major challenge that we've got, is that our revenues just simply are not keeping up with the demand, with even our maintenance. And we're getting further and further, regrettably, we're getting further and further behind. In 2015, we dropped significantly in the price of gasoline. And when that occurred, our gasoline, our revenues, which are based on revenues for the transportation cabinet, are based on the sale of gasoline. So when that dropped, we lost about $180 million a year, which over the last 4 years has translated into almost $1 billion. Now, what that means is, and as you know, Judge, what that means is that the roads don't get repaired as quickly. New roads and highways that we need for economic growth and development don't get built. The bridges don't get repaired as quickly as they need to be, and new ones don't get built. And, you know, that's a slippery slope. If you let it go for too long, it's sort of like the frog in boiling water. You know, the frog doesn't realize until that boiling water is already too hot and he's already gone. And that's what I was trying to convey, is that we're in a period where in the last 5 years, we have seen construction costs for highways rise more than 30%. And at the same time, our revenues in the transportation cabinet have been flat. And compared to other states all around us, where their revenues are significantly greater than ours. So that was really my appeal. And my appeal said, you know, folks, to the senators on the committee, I just said to them, you know, let's think 5, 10, 15, 20 years ahead. And what kind of state, what kind of transportation system do you want? What kind of economy do you want that's based on transportation system, an efficient transportation system? That was really the message that I was offering today. And fortunately, you know, I see that there's a real recognition and understanding of how significant this is. And I really want to thank the judges from around the state and the mayors around the state, Judge, because that's the voices that have been there about this. Now, I think you wanted to talk about.
Right.
Go ahead.
Go ahead.
No, I said.
Well, what I wanted to say was that $1 billion, if you break that down, about 480 million of that would have flowed right down to local governments.
48.2%.
That's correct. So if you look at 120 counties, if each of them got $2 million, that's 240, and then the other cities would have gotten some of that. We could do a lot of paving, a lot of repair and building and improving roads, and make them a lot safer. And just as a comment, and one of the reasons that Jim makes such a great Secretary of Transportation, a great advocate, is his stint as mayor of Lexington. He's been there. He's had to deal with citizens complaining about the potholes and complaining that their street hadn't been paved in 35 years. But I continue to hear, and I've been here 10 years, this is my 11th year, and forever I heard about, we've got to do that within the confines of comprehensive tax reform. Well, while we waited for comprehensive tax reform, we've lost $3 billion. Think about it. Roughly 10 cents is roughly $300 million a year, actually about 350, 360. Right. Times 10 years, think about what we could have done for $3 billion. Can you say a new bridge down at Henderson? how sorely we need that bridge. Can you say, and I don't want to mess this up, Brent Spence Bridge, how tough, and those bridges, there's a direct correlation between them and economic development and traffic and inflow into our communities and being able to get the products that all Kentuckians manufacture out of our communities. So it's extremely important. Nobody likes a tax increase. Absolutely nobody likes a tax increase. But if you go to the state of Indiana right now, I think Kentucky's gas prices are as high, if not higher, than they are over in Indiana. And they just added a 10 or 15 cent gas tax increase. So that's all over here, though. I want to take a little bit of that time because that's your expertise and that's what you serve as is Kentucky Transportation Secretary, and do a good job. And I've said it before. I've heard no bad things about you and the job that you and your staff do. And that's always a good thing because as Dean, I hear all the bad things as well. What we're talking about, though, is you are the COVID czar. Not only did the governor appoint you as the Secretary of Transportation, he made you the czar of COVID relief, COVID vaccine distribution. I think I sent you a text congratulating you on your new position and the fact that you got no more money for doing it. And that's just typical of public service.
Well,
so tell me a little bit about your experience diving into the distribution of the vaccine. Tell me the number one problem, and you and I both know the number one problem that we have in the Commonwealth, that being not enough vaccine to go around. But just kind of give us a little rundown, not a long time, but just a little rundown about the day you started and where we are today.
Well, I appreciate that opportunity, Judge. And fortunately, I've got on with me today Mark Carter, who is the former CEO of Passport Health in Louisville. And Mark was also the head. He led in the the tracing project. Forgive me, Mark. So in the tracing project, Mark led that, and he is standing up our project management office for the vaccine. And you've been generous because you expanded my role dramatically. We're here to assist. We really came into what amounts to, with Dr. Stack and with the governor's leadership, a very high performing team. And that team has brought us to this point. But when you think about it, you had the virus itself and managing that, and then the tracing project that Mark managed, and now we've got the vaccine and that project to manage. And that project, Al, has been described, the vaccine distribution and logistics project has been described as the largest logistics project in world history. Mm-hmm. The numbers that it represents. When you look at Pfizer, Pfizer released their vaccine 11 weeks ago. Moderna released their vaccine to the public 10 weeks ago. And in that 10 and 11 weeks, in Kentucky alone, almost 17% of our eligible population, that's the population over 16, has been vaccinated. Mm-hmm. We will cross 600,000 unique vaccinations this week. Last week, or I believe it was on Monday, wasn't it, Mark? We were 594,000 and change.
Yes.
Right. So we're crossing quickly. We will cross 600,000. And you're right, Al, you're absolutely right that the challenge so far has been three words: supply, supply, supply. Because, for example, Owensboro Health has gotten vaccine, and the Green River District Health Department under the leadership of Clay Horton. You mentioned Clay, who's a great guy, and I hear nothing but great things about him from Dr. Stack. Isn't that right, Mark?
He's one of the best district health department leaders we have in the Commonwealth.
I second that.
Enjoyed working with Clay.
So when we look at this and where we have been, we've actually in the literally four to 5 weeks time, we have turned on. By that, I mean, vaccines have been distributed to almost 350, will be soon 350 sites. Now that includes the 5 operations that you described earlier. The state
Could you kind
operation.
of go through those so people understand it's not just the hospital that's doing it or the nursing homes, it's
Right.
5 separate programs.
Right, and if I forget one of them, Mark, you correct me, but we start out with the long-term care and assisted living. And that was managed by the federal government. And it was managed through the pharmacy, CVS and Walgreens. Then there's the state program. And the state program began with our hospitals, and then the state program expanded to our local health departments, the 61 local health departments, just like Green River, of course, is one of those. Then we have the federal pharmacy program that now is, I think, Mark, is 2 million doses a week, 2 million vaccines across the country a week. And we're getting then about 32,000 from that program. And that's through Walgreens and through the Good Neighbor local pharmacies. Then we've got the VA and the Department of Defense program that represents the opportunities for veterans, particularly focused on veterans. And what have I forgotten, Mark?
The federally qualified health
federally
Yeah.
federally qualified health centers, right? Which
Now,
is
we haven't started that yet, or at least in this area, I don't think that's been implemented yet. I'm assuming we're working the logistics out going
Mark's
forward.
working on that as we speak. Why don't you talk to that, Mark?
Okay.
We've started activating federally qualified health centers in areas across the state that have been, I guess, underserved, relatively speaking, to some of the larger urban centers. I think we've activated one that operates in Muhlenberg County and some of the counties just south of you.
Mm-hmm.
But we'll be activating more of those over the coming weeks as we get more vaccine.
You know, that brings up a point and a question I was going to ask, and you're probably not going to be able to answer all the questions, and I'm not trying to play gotcha on anything. But we've been trying with our local hospital and our health department to identify those at-risk census tracts. And we've identified 3 or 4 of those census tracts where 15 to 25% of the homes do not have any transportation means. The majority of the folks are elderly, would not have computers, would not have cell phones. And a lot of our minority populations, the Asian Americans, African Americans, Hispanics, are living in these tracts. And we're trying to figure out a way to address their needs. It's pretty simple. If I had to drive 60 miles to get me vaccinated, my wife, I would, or if I had to take by somebody, I would. But there are people who don't have that capability, don't have the resources to do that. If communities, and I saw a program similar to this in Lexington, where I think it was the Lexington Health Department and the UK Health,
yes,
and worked, and were getting an allocation of vaccine to be used in those census tracts. And I wondered if local communities, if there was a capacity for us to develop some kind of a program, send it in to you to look at and review if that would be considered as a possibility in those communities. And I'm not just talking about Davis County and the city of Owensboro. I mean, any community that would want to go to that length of research.
You're absolutely right on that, Judge. And those who are most vulnerable are of course those who we ought to be reaching out to. And the social vulnerability index gives us some idea of where we can be targeting. Now, a lot of this opportunity and addressing of it will come with the increase in the vaccine.
Right.
You know, what UK is also doing is they've developed a mobile unit.
And we talked about that.
Right.
And to me, I think that's the way you get into those communities.
Right.
We could use our churches and our community centers and neighborhood alliance groups to identify names and phone numbers that we then could come back and have folks contact them to set the appointments for them. Kind of like what Davis County Fiscal Court has done for our unemployed. There are a lot of folks that needed help. They call us, we put the information in for them, and then get somebody from the state to contact them. And I see there's no difference in doing this. And it's in that same vein, in those communities though, Jim, there seems to be a lack of vaccine awareness, a lack of vaccine faith. They just don't want to, they're afraid of the vaccine.
Well, you know, and you're absolutely right on that. And what the governor was just today in Lexington at a church, Shiloh Baptist, which African-American church, a historic church in the community. And he was there as to demonstrate, along with some African-American preachers and ministers, of course, to demonstrate that how safe the vaccine actually is. And that's a big part of it. What we are also seeing, Al, is that the more people are vaccinated, the more others are seeing that it is safe, because their friends and their neighbors and their family members are getting the vaccine, and they're seeing that it's safe and no real significant after effects. So our sense is that the more supply we get, the more robust our distribution system becomes, you know, with these 350 sites, for example. And then with our outreach, especially through our local health departments, because they're the ones, as Mark knows well, and Dr. Stack reinforces, they're the ones who know within the community, their friends and neighbors who are most vulnerable, and we need to reach out to. You know, you're going to know that. Yes. Elected officials are going to know it. You know, your city council members, commissioners are going to know it. And that's when this network starts really working in an effective way.
Well, I think you're right. And I certainly agree. The more folks who have received the vaccine locally, I hear, and I don't have any statistical evidence to prove it. It's all anecdotal. It's all the buzz that's in the community. But there are folks who absolutely said there's no way that they're going to inject those nanodes into me and be able to track me all over the state, who are now saying, how do I get the vaccine? How do I get signed up for the vaccine? That's one thing. And another, I'm going to tell you another phenomenon, and the governor alluded to it this morning, that I'm seeing is more folks seeming to wear their mask. It seems like there are more people masking up when they go out in public than there was before. Do you see that all over the state?
You know, that seems to be a pattern that we see increasingly. You just don't, you see it routinely now, that folks are masking up just like you described. And you've heard Dr. Fauci say, and Dr. Stack has said as well, that it's not the sort of pattern or routine that we should abandon overnight if we do get to herd immunity. You know, this vaccine, the variations on it, that's still incredibly complex science here.
Judy and I both had our 2 shots, Moderna.
Mm-hmm.
I had a little bit of a reaction, a little ache. About 24 hours later, I felt a little achy, just felt blah. Woke up the next morning, I was fine. Judy had no issues whatsoever. Now, the first shot, she had what they called COVID arm, a little swelling in the arm, but she had no problems either. Now I understand, and you may be able to help me out, but somebody, or I heard, didn't Johnson & Johnson just receive emergency approval?
Just received it. In fact, they are predicting that and of course it's a single dose.
Right.
And the prediction is that Johnson & Johnson will deliver 100 million doses by the 1st of June. And I think, Mark, aren't we talking about in the next couple of weeks, 20 million? Does that sound right? I heard Dr. Stack.
Nationally, yes.
Yeah, nationally, 20 million, which translates to us at a 1.3%. If we get the same ratio that we've been getting, it'd be a 1.3. So that'd be 26,000 additional doses. So
And
soon,
that's huge. That's huge
Yeah.
because that vaccination infrastructure that you've got to put together, you have to do it 2 times
right,
now. Where now, and particularly with a mobile vaccine system, I mean, you could go to large, as a matter of fact, my people in the road crew asked me, said, Judge, have you used that gravelly voice of yours to advocate for us getting the shot? And I said, absolutely, yes. And it would be great if we could do it like we do the regular flu vaccine. We have somebody come and administer them all in one day to anyone that wants it. One of the questions, though, and one of the statements, and I think, again, the governor addressed it, and you probably have, and you probably know where I'm going to go. There are those who say, well, Moderna and Pfizer are 95% effective, and this is 70, 75% effective. And I think most people don't understand that our regular flu shots that we get aren't that effective. They're probably in that 60, 65%. Really, with the Johnson & Johnson, though, the effectiveness in preventing you having a serious complication or dying that's what's the great part of Johnson & Johnson.
Exactly right. It has,
it would seem to me, younger folks who have a more robust immune system, younger folks who suffer the serious consequences or don't suffer those that the older folks do, would be wanting to get that vaccine, get the one shot, get out of there.
Right. Mark, I think you wanted to
one of the questions that I got asked, if you want to say anything else, you could remember this is a give and take. I'm giving and you're taking. So a question was, how about the schools? Are they going to fully reopen in 2021? And I can tell you locally, for whoever posted that question, that tomorrow evening there is going to be I believe it's a joint Owensboro Public Schools and Davis County Public Schools school board meeting where they're going to vote to reopen the schools for the rest of the school year. Now, that doesn't mean they won't go virtual again at some time. It's things change. This is this pandemic puts everything in a state of flux. And it seems like instead of dealing long term, I'm putting out fires everywhere I go. But that's what you have to do in a pandemic. But I think that at least for Owensboro and Davis County, you will have that answer tomorrow evening after those 2 school boards meet. Now our Catholic schools have already opened. They've gone back and they have been going in person. I think we just answered this one. The question was about the approval of the Johnson & Johnson vaccine. When will it be distributed in Kentucky? And I believe that, did the governor say next week or the week after at the latest?
Yes. Yeah. It's effective immediately, and the distribution will occur immediately. Yeah. Okay. So we're looking at our distribution, Mark, would be then the week of so next week is the 1st, right?
Probably the week of the 8th is the most likely.
Yeah. Right. Yeah. The week of the 8th for Johnson & Johnson.
Mm-hmm.
We are rapidly finishing up with 1A. My understanding is that all the nursing homes, all the federal contracts with the pharmacies, they made at least 2 passes. They're making their 3rd pass to finish up. Do want to remind anyone that did not get the vaccine then, who chose to wait a while, and if you fall in that 1A, 1B, or 1C category, you can still get the vaccine. You just won't have it delivered at your workplace. Once that's done, and I asked you this question 2 weeks ago, that vaccine is gone. That vaccine is not put into the pot that we distribute through the rest. So it's a separate program. I assume that vaccine will go back into the government's bigger pile and then be distributed nationally. Our program with, I think it's Walmart, who was vaccinating our teachers. I think that's pretty much close to being finished.
Yes, we're actually through the
Yes, go ahead.
K-12 numbers.
Right.
Some of
And
those are
once they-
still perhaps coming in, but by and large, we're through K-12.
Are you finding, do you have any statistical evidence or statistics that you can give us about how many of our nursing home staff and
Well-
residents are taking the vaccine and how many are turning it down? How many teachers, how many staff at the schools? Because if you don't have bus drivers, you can't have school. If you don't have lunchroom attendants, you can't have school. So
I know
what
that
is
the nursing home, that the assisted living and the long-term care and the assisted living staff, those numbers were a little discouraging, actually, weren't they, Mark? We were around
Yes, they
50,
were.
55, 60%. Now,
Right.
since then, this is what we're seeing, and this is somewhat anecdotal, but that people are seeing folks who were vaccine hesitant have seen their friends and neighbors and family
Right.
get the vaccine without any after effects. And so they're now coming back and saying, okay, I'm rethinking this. Let me get the vaccine. And I
think
believe, yeah, go ahead, Mark.
Secretary, I think we're seeing that in the nursing homes now that, as we pulled back the vaccine to use it in other areas now, staff and people that are being admitted to nursing homes want the vaccine. So we're having to sort of circle back to that. So that, yes, that's happened.
Jim, we were fortunate here back at the very beginning in March, April, May. The virus ran rampant through our federal and state prisons and our local jails. We were fortunate. We kept it out of Davis County Detention Center until December. About the middle of December, we had our first outbreak, about 45 or 50 prisoners and staff. We were able to isolate them. And then we had another outbreak in late January. Seems like that's gotten under control, and hopefully, and we were doing everything. We were providing masks to prisoners and sanitizer. The only thing you can't do in jail very well is socially distance. I mean, it's just,
That's right.
they're not designed for that, but we were able to set up isolation wards. So if you tested positive, you were put in the isolation ward. Now, lots of mamas, daddies, husbands, girlfriends, and everybody else would tell the stories where we mistreated the prisoners. We had no reason to want to mistreat anybody. We tried to treat them all with dignity and make sure that they're, and to the credit of our jailer, we did not lose one prisoner to COVID-19. So, I mean, that's pretty good, because I can tell you, we have a prison over in Muhlenberg County, I think, and there were a lot of prisoners that passed away from those outbreaks. We also have a long-term regional recovery center here. Very, very fortunate, kept it out there forever. About the same time the jail got hit, they got hit, and about half of those folks. So what are you seeing in prisons and jails and other institutional facilities? And I'll throw nursing, it's no different in a nursing home or a assisted living. You have large groups of people who are tightly packed, see each other every day, and even though they follow the best practices, you're still going to pass that virus around. Are you seeing those kinds of situations come under better control?
Well, the positivity index is declining, and it's declining across the board. And so when the staff, of course, is vaccinated, and when the positivity index is declining, then we're seeing that the level of anxiety and concern is diminished to some extent. But that's not to say that we can avoid it entirely, because it certainly exists, as you described it, Judge.
Always the possibility when you deal with a virus. I mean, there's always that possibility. And folks, I come from a time when if measles got into our grade school, everybody got the measles. I'm the oldest of 12 kids. When mumps got into our family, everybody got the mumps, everybody got the chicken pox, everybody had German measles, 7-day measles, 3-day measles, and whatever other kind of measles there was. So, I mean, that's what viruses do. Viruses look for a host. You know, think about it. Originally, I heard a lot of folks talk in terms of this virus isn't anything, why the flu kills as many people every year. In a bad year, the flu might kill 60,000 people. In less than a year, COVID has killed 500,000 people. 500,000 people. That's 10 Vietnam Wars. Think about it. 500,000 people at 4.5 million. What is that? That's 10, almost 15% of our population in the Commonwealth. Think about that.
Right.
It's just it's serious,
Right.
and it's more virulent and spreads, and particularly the variants, which is what I'm going to ask you about now. We keep hearing about the UK variant, the South African variant. I know the UK is supposedly more virulent, spreads easier than the standard COVID. Supposedly, from what I hear and read, the vaccine is as effective against that strain as it is against the standard COVID strain. Not so much understood about the South African. Mark, I see you shaking your head. Are you about to talk to us?
Yeah.
Well, I'm not sure that I can talk at the level of detail that you just did about the vaccine, Judge, but or at least in South Africa and the UK. But the evidence does show that the two vaccines that are being used in the States are effective against those variants.
And again,
in important things like preventing death and hospitalization.
Right. That's what I was going to point out. Again, perhaps not preventing it 100%, but keeping you out of the hospital, which is very important, and preventing death. So what I did have well, no, we already answered that one question. Will the state add more vaccine sites in Davis County? And this is a real question, Jim. It's not me busting your chops. Have those sites been identified yet?
The hospital's done such a good job, and your local health department doing such a good job, that what we're trying to do is encourage those that are already doing really responsible work and a good job, encourage them to increase their throughput, increase the number of vaccinations that they're giving. Now, I'm not sure, Mark, what about our pharmacies and what's our out? I didn't check on Owens.
We had a Kroger site on South Frederica that's supposed to open.
Right.
Okay.
What we're looking for, Judge, is first of all, just retail sites, pharmacies, whether that's in a Kroger or Walmart or a big box. The other thing that's pretty good news is that the federal program, which is working with independent pharmacies, is the intent there is to activate more independent pharmacies in Kentucky. So right now it's the AmerisourceBergen Good Neighbor Network, but we think in the next few weeks that'll be expanded to include other independents. And I know that you have it. I know of at least one independent pharmacy in Owensboro, Daviess County that is an important player there, and I think will ultimately be activated. The whole issue has been just, it all comes back to availability of vaccine, and that's just getting better each week. And I think as that happens, you'll see more sites in Daviess County and in your surrounding counties for that matter.
Yeah.
Well, I'm glad to hear you say that, because on social media, where I try not to go very often, I saw somebody complaining about one of our local pharmacies that supposedly was going to get vaccine, and then it was pulled back from them. So, I don't know what happened there. Folks, I would caution you, we just went through 2 major winter storms in 1 week. That really set things akimbo, so look over the next couple of weeks for things to get back on schedule.
One of
Yeah,
the, of course,
there were some weather-related issues. I don't know if that was this specific instance, but we had
some
delays in
challenges
delivery.
too, the challenges too, Al, and Mark knows this, of course, really well, that Dr. Stack and that we have to deal with in the allocation process is the plate, the Pfizer plate comes in a minimum of, what is it now, 1,160,
70.
170, Mark. It was 975 vaccines, and now it's a little over 1,000 because they found this more in a vial. But Moderna comes in a minimum plate of 100. So you in the shipping, it's clearly a challenge. Let's say that, for example, Owensboro Health, then we were trying to allocate the Pfizer. Well, it'd be a minimum one plate, Owensboro Health, of 1,160 vaccines that they'd have to get processed. They'd have to shots in the arm within a week.
But tell me, just for the folks out there, when you say a plate, a pallet, a shipping carton that has dry ice on it to keep it at the temperature so it's not wasted. So
That's right.
once you open that plate, what you call a plate, you got to use it. You got to push it.
You got to push it through. Yes. It's 90. The goal is 90% of the vaccines we receive will be shots in arms within 7 days. That's the governor's goal.
And I believe that I can speak for all the sites here in Davis County. We're doing that already.
Yep.
So when
Yeah,
people talk about more sites to get vaccine, it's not a function of sites. It comes back, it's a function of vaccine availability.
There are actually, Judge, there are 1,500 eligible providers in the state.
Right.
Now we're utilizing now just right at 350, right, Mark? Right, isn't that right?
Yeah.
So after the latest Walgreens are activated.
Right.
Judge, you said that you gave us about 45 minutes and
Yes.
said you were going to turn us off in 45 minutes.
Well, I've still got you, so I'm not going to turn you off yet. Just one other question,
Okay.
and I think this is important for folks to hear it from you guys. Oftentimes, anecdotally, again, and that's why I hate when, my background, believe it or not, I'm a mechanical contractor who's educated in biology and chemistry, and I happen to be a judge executive. But in the sciences, we use lots of data. We don't just take one data point or two, or, we don't take anecdotal instances. We take lots of data and it's got to be repeated. So when you get an anecdotal instance of something happening, you've got to take it with a grain of salt.
Right.
We hear, I see it every day, of folks who haven't, in 1B, haven't got vaccinated, but 1C hasn't even been open, and they hear people going to this drugstore or going to that health department or going in the next county, and they're 1C and getting vaccinated. Or they may be in their mid-50s and they happen to get a vaccine. I know what's happening there, but the people would rather hear it come from your mouth or from Mark's. What's happening there? How's that happen?
Well, the way I describe it, and Mark, you can footnote or add and supplement. The way I describe it is that you're getting some folks that are in A and B who have been late to get their vaccine. And you have some that are in C that are, and I describe it as there's some porosity. There's some porosity to these levels or these tiers, Judge. It's not that, hold on just a second, let me turn my phone off.
I hope that's not the governor. If it's the governor, don't turn it
It
off.
wasn't. It wasn't. I was going to say, give me a minute here. So there's some porosity here. And sometimes at the end of the day, you don't want to lose any of these vaccines. And so each one of these providers has the freedom or the liberty to bring people in so that they don't waste any vaccine.
Right.
And so that means perhaps moving into 1C from a 1B.
Okay.
Or 1A even.
Well, remember, I'm a Catholic.
Yeah.
And we believe in sin. And which is the greater sin?
Yeah.
For somebody in 1C to get a vaccine or to waste that dose of vaccine? And you know, and I know what the greater sin is.
But we
don't
have
want that.
seen, Judge, we have seen people really respecting the honor code and
Yeah.
on our honor system.
Yes.
For example, we are right at just over half of the over 70s eligible. Over 70s, we're just at 50%, and we've done that in less than 2 weeks.
It's amazing.
So
It really
that's
is amazing.
almost 250, about 220,000. Our over 70 population is about 450,000.
Right.
And we're right now at a little over 220,000.
And remember what we said at the beginning, why it's so important to get those in our senior population. 92% of the deaths occur in those who are 60
Right.
and older. Well, Secretary, great, and Mark, and I never heard from Chuck or from Elena, but it was nice having you with us. I hope that we answered a few questions folks had. Once again, I just want to take the opportunity to thank you, Jim, for the really outstanding job that you're doing in both your positions. Which is better, a secretary or a czar? Which one has more power?
I was going to say, I thought you were going to say mayor.
Well, Mayor, I know, and you probably still pull a few strings then, but
I always said, and you know how this is, that that it was Tip O'Neill, I think, that said all politics is
politics are
local.
local.
When you're a county judge and when you're a mayor or you're a city council member or a commissioner, you run into your constituents at the grocery store, at the gas station, everywhere.
Yep.
And that keeps you tuned up. It keeps your eye on the ball.
It does.
It doesn't it? That's exactly what I thought.
Well,
So thank you
I
very
had a
much.
conversation right before this started. I had a conversation with a citizen, and he was berating me because politicians never listen to their constituents. And I asked him, I said, "What do you think I'm doing with you, dum-dum?" Oh, thank you guys very much. Look forward
for having us.
Thank you,
to
Al.
seeing you soon. Be safe. Everybody
Thank
be
you, sir.
safe.
Be safe.
Thanks.